The following video will discuss the emergency supplies needed at the bedside for all tracheostomy and laryngectomy patients. As a reminder, a tracheostomy creates an artificial airway established through a surgical incision in the neck, whereas a laryngectomy, the patient either has a permanent, irreversible stoma, which leaves the patient unable to speak without assistance, as in a total laryngectomy, or there is a surgical removal of a portion of the larynx, which may leave the patient with some speech capabilities and more normal swallowing functions, as in a partial laryngectomy. The following supplies must be in the patient room at all times: a resuscitation bag and mask appropriate to the patient size, also known as an AMBU bag or BVM. Suction equipment, including suction catheters of appropriate size if inline suction is not set up, and a complete wall suction setup is required. If wall suctioning is not available, a freestanding suction device capable of delivering continuous suction must be set up in the patient's room. An extra tracheostomy tube of the same size should be kept at the bedside. For percutaneous trachs, a standard trach of the same size is needed. If you do not know what an equivalent standard trach is to your percutaneous trach, consult with the respiratory care practitioner. Additional trach types can be viewed in the policy Tracheostomy Care in Policy Stat. The obturator of the current tracheostomy tube and extra disposable inner cannulas are to remain at the bedside. For a percutaneous trach, there is no obturator. Percutaneous trachs also have a special inner cannula that the RN can get from central supply. Do not use regular inner cannulas for these trachs as they are too short. Additional supplies that must be in the patient's room include spare trach ties, humidified oxygen as needed, unit dose sterile normal saline, a manometer with the appropriate size syringe. Spare trach ties can be obtained from the unit or central supply. The other supplies can be obtained by coordinating with the respiratory care practitioner. We will now discuss the emergency supplies needed for the laryngectomy patient. The supplies needed will depend on whether the patient has a total or partial laryngectomy. All laryngectomies need a Portex tracheostomy tube, size 6.0, for an emergent airway. All laryngectomies need standard suction equipment set up. Whether a spare tracheostomy is needed at the bedside will depend on if the patient has a partial or total laryngectomy. Consult the respiratory care practitioner for whether an additional spare trach is needed at the bedside. Partial laryngectomy patients will still be able to use a standard bag valve mask for resuscitation, as there is still a connection to the nasal oropharynx. Total laryngectomy patients will need an AMBU bag in the room with an infant-size mask if needed to ventilate the stoma, as there is no connection to the nasal oropharynx. We will now discuss the steps you need to take in the event of an accidental tracheostomy dislodgement. Position the patient for attempted tracheostomy reinsertion by placing the head of bed down and the head in sniffing position. Obtain the obturator from the head of bed and remove the inner cannula from dislodged trach and place the obturator into the trach tube. Lubricate the trach tube and or stoma site with water-soluble lubricant and stand at the head of the bed looking down towards the feet for proper angle for insertion. Gently attempt to reinsert the tracheostomy tube. If you meet resistance, stop immediately and support airway, as continued pushing could lead to tracheal perforation. If tracheostomy placed in correct position, inflate the cuff and gently attempt to ventilate the patient. Be sure to auscultate for correct placement by hearing bilateral breath sounds. If no air is auscultated, you may be in the epigastrum. In the event that you are unable to reinsert the tracheostomy tube, cover the stoma to occlude the site and provide breaths with the bag valve mask. If at any time you need additional assistance, call a code blue.